Good afternoon, dear students. So, continuing with our lectures on anatomy and upper limb, I am going to start with a very beautiful and a very small short note, a very important short note, clinically a very important topic, that is the cubital fossa. Now, this is a very important topic, a very small topic, a very interesting clinical topic. We are going to discuss about the depression which is present here in the front of the elbow, that is the cubital fossa. Now, this is a fossa, and as we talk about any answer in points, we'll talk about this answer also in points. So, first will be introduction, then you will write boundaries, you will write the roof, floor, contents, and last point is applied anatomy. So these are the points on which you are going to write any fossa, any triangle, anything in anatomy. You will write under these 4 points: introduction of that topic, boundaries, roof, floor, contents, and applied anatomy. Okay. So we'll talk about one by one now. First, what is cubital fossa? Introduction of the cubital fossa. It's a triangular hollow which is present in front of the elbow joint. Okay, so it's a triangular depression or a triangular hollow which is present in front of the elbow joint. So next point is, what are the boundaries? Okay, so as we said, it is a triangular depression. So this is how the triangle is. It's an inverted triangle, it's not a regular triangle. So this is a triangle. A triangle has 3 boundaries. It will have a base, it will have a lateral border, it will have a medial border, and it will have an apex. Okay, so what does the cubital fossa, when you talk about the boundaries, it will have a base, it will have a lateral border, it will have a medial border, and it will have an apex. Okay, so this is how we are going to talk about the boundaries. Now, what are all these things going to be formed of? Okay, now when you talk about this, firstly, what you should know, that the lateral boundary and medial boundary are going to be formed by muscles. Okay. So which are these muscles which are going to form this? The lateral boundary is formed by, there is a muscle which is going to go like this here. Okay, this is formed by medial border of brachioradialis. The lateral boundary is formed by medial border of brachioradialis. Brachioradialis is a muscle here. So medial boundary of the brachioradialis takes part in the formation of lateral border of cubital fossa. Medial boundary is formed by, now this is the medial boundary here, there is a muscle which is going to go like this here, and this muscle is lateral border of pronator teres. Okay, so medial boundary is formed by lateral border of pronator teres. Okay, so lateral boundary is formed by medial border of brachioradialis, medial border is formed by lateral border of pronator teres. Apex is formed by meeting of medial and the lateral borders. Okay, clear till now? Now the base of the cubital fossa is formed by, the base of the cubital fossa is formed from, you have the humerus here, medial epicondyle is here, lateral epicondyle, medial epicondyle, you have the capitulum, trochlea here. Okay, so there is an imaginary line which is going to join the 2 epicondyles of the humerus, medial epicondyle here, lateral epicondyle here. So that would be the base. So is this clear? So what are the boundaries of the cubital fossa? Lateral boundary is formed by medial border of brachioradialis. Medial boundary is formed by lateral border of pronator teres. Apex is the meeting of the medial and the lateral borders, and the base is formed by an imaginary line joining the 2 epicondyles of the humerus. I hope this is clear. So that is about the boundaries. The next point is the roof. Okay. Now roof of this fossa. Here, if you talk about the roof, what is going to be the roof of the fossa? From above downwards, the roof will be formed by skin. Below the skin, you will have superficial fascia. But in the superficial fascia, there is a very important vein that is going to be here. Okay, that vein, if you draw the cubital fossa here like this, there is going to be a vein which is used for taking intravenous injections and taking blood for examination purpose. So there is a cubital vein, the basilic vein, and the vein which is connecting this is called as median cubital vein. Median cubital vein. So this is the vein here. Okay, this is the cephalic vein here, basilic vein here. There is a vein which is connecting them. that is median cubital vein. These are the veins which are going to be in the superficial fascia. Then you will have deep fascia, and below that you will have bicipital aponeurosis. If you remember, when we had talked of the biceps muscle is going to come here, the tendon is going to be here, and when it reaches its insertion, there is a flattening of the tendon, and that flattening of the tendon will be called as the bicipital aponeurosis. So that is going to be the roof. So what are the contents of the roof again? It will have skin, superficial fascia with median cubital vein, and you can add superficial nerves also. Then you will have the deep fascia, and then below the deep fascia you will have a very important aponeurosis which is called bicipital aponeurosis. I hope this is clear till now. So that is the roof. Now the floor of the fossa is formed by two muscles, brachialis which lies below the biceps and supinator which is a deep muscle there. Okay, so brachialis and supinator are the two muscles which are going to form the floor of the cubital fossa. I hope till now it is clear. Now coming to the very important part of the cubital fossa are the contents of the cubital fossa. Now the contents of the cubital fossa can be remembered by a very simple mnemonic, MBBR. Okay, some people call it MBBS also. There are four contents which can be seen from medial to lateral side: median nerve, brachial artery, biceps tendon, and superficial branch of radial nerve. Okay, so we'll try to understand that now. So if this is the cubital fossa here, okay, what did we say? The contents of the cubital fossa. This is medial side, this is lateral side. If you come from the medial side, you will have first will be the median nerve. Okay, first content will be the median nerve. Okay, this median nerve, what you should know about the median nerve? This nerve is going to come from the arm and going into the forearm, and it passes between the two heads of this muscle. This is pronator teres. So the first content is median nerve. Okay, so what do you should know about the median nerve? The median nerve is going to pass from the arm into the forearm, passing between the two heads of the pronator teres, and therefore it passes through the cubital fossa. The nerve in the cubital fossa is the median nerve. Then besides the median nerve, so next, so this is your M. Okay, now what is the B? The B is the brachial artery first. Okay, brachial artery. Now what you should know about the brachial artery? This artery is going to divide in the cubital fossa into two main arteries. That the lateral side artery will be called as radial artery, and this will be ulnar artery. So there will be the division of the brachial artery, which is going to come into the cubital fossa, and it is going to divide into radial and ulnar arteries in the cubital fossa. Okay. Now besides the brachial artery, laterally, so that is the B, M, then B, you will have the biceps and its tendon. So you will have the tendon of the biceps with the bicipital aponeurosis here. So that is the biceps, that is the next B. Okay, so this is the biceps tendon. Okay, so this is going to be lateral to the brachial artery, and the last content is the radial nerve, superficial branch of the radial nerve. This is going to be embedded below the brachioradialis. Okay, so these are the four contents: median nerve, brachial artery, biceps tendon, and superficial branch of radial nerve. Okay, so this is your S. So this is superficial branch of radial nerve. Some people call it as MBBR also. You can call it MBBS also, but remember that S means the superficial branch of radial nerve. So I'll repeat, what are the contents of the cubital fossa? The contents of the cubital fossa are: first content is median nerve. What you should write about the median nerve? The median nerve is going to enter from the arm into the forearm, passing between the two heads of pronator teres. Besides the median nerve, you will have the brachial artery. What you should write about the brachial artery? That the brachial artery is going to divide into the cubital fossa into radial and ulnar arteries. Besides the brachial artery, lateral to the biceps tendon. But here now you have to understand a very important thing. All of you can feel the tendon of the biceps here. Just medial to the tendon of the biceps, which is this relation, which has to be understood throughout life, is the brachial artery, which you can feel the pulsation of the brachial artery here, and lateral most content is the radial nerve. Okay, so these are the contents of the cubital fossa. Now the last part of the cubital fossa, why the anatomy of the cubital fossa is important? The anatomy of the cubital fossa is important because of the important contents which it has in it. Okay, so the median nerve is there, the radial nerve is there, the brachial artery is there. So what is the anatomy? The first thing, the simplest thing which all of us know, that universally blood pressure is recorded in the upper limb by feeling the pulsations of the brachial artery here. So you know that the cuff is applied, you can auscultate the brachial artery by taking blood pressure. So that is the first thing. Second important thing, the common fracture of the humerus, which is called as supracondylar fracture, the fracture of the humerus which occurs here, it gains significance because it can damage the structures which are going to be there in the cubital fossa. It can damage the median nerve, it can damage the brachial artery, or it can damage the radial nerve. So therefore, fractures of the supracondylar region of the humerus are clinically important because of the structures which are going to be there in the vicinity of the cubital fossa. And one more applied anatomy which is again very important is when we talked about the roof of the cubital fossa, we had seen that there is a vein in the roof of the cubital fossa. That vein was the median cubital vein, and this vein is used for withdrawing blood for investigation purposes and can also be used for giving intravenous injections there. Okay, so that is in short about the anatomy of the cubital fossa. Please remember how to write the answer. Write the answer methodically in points. Remember the points, and so that you can do not miss any point and write the answer properly. So I hope you have liked the video. The video has been nice. I again request all of you to please like the video, share the video, and subscribe to my channel. Thank you.